Arua City is one of the newest cities established by an Act of Parliament on April 28, 2020 as a regional city for West Nile sub-region and became operational on 1st July 2020. The city lies in the northwestern corner of Uganda between latitude 030, 10 north and 350 north and longitude 330 east and 310 30 east. However, I undertake to unpack the HIV/AIDS prevalence in this newly created city of Arua compared to other created cities in Uganda.
For example, some people are saying, oh, if COVID and Ebola can kill very fast, then HIV, which can make people to live up to ages, is even better.
The prevalence rate is at 3.1%, but in the previous financial year it was at 2.8%.
Despite this, there are several factors explaining the trajectory here. According to statistics, Arua City has about 11,000 registered HIV clients. 3/4 are women, while a quarter are men, including those from Democratic Republic of Congo. Most intriguing, between 331 new HIV cases were registered in Arua Hospital between the period of January 2020 to June 2021.
For the previous financial year, the prevalence rate for the boys was at 1.1%, the girls was at 0.6%, then the men was at 2.8%, and the women was at 1.6%, and this is according to the district health information system.
With the booming business here, ever since Arua municipality was elevated to a city status in April 2021, the status has attracted a huge influx of people from different walks of life, making the lucrative trade of prostitution a selling hot potato that has spiked the HIV prevalence in Arua City from 2.8% to 3.1% over the last 2 years.
In the past, the number of sex workers in the city was not as it is now, because as I speak, we have about 608 sex workers in the city, and we have even the gay people, about 100 of them. This business moves together with the presence of drivers. So each station, they keep on getting new wives.
A 2021 report from Arua Hospital indicates that the city is sharing the little with people hailing from DR Congo. The challenge at hand has made work difficult for health workers to track some of the clients. The situation became more worse during the COVID-19 lockdown, when a presidential directive on the ban of movements was effected.
COVID cost a lot, because during COVID time, the HIV clients were not able to access medicine, even testing services dropped.
This complicated the prevention of mother-to-child transmission of HIV/AIDS. Despite of these challenges caused by the COVID-19 lockdown, the city authority is now focusing its attention on managing the prostitution business, taking center stage in Arua City.
Continuously create awareness, looking at local existing structures about self-protection and safety. If you can abstain, abstain. And in line with that, trying to make sure that the condoms are available. Most of these hotels are stocked with the free condoms. The other thing is to map out where are these risky places to increase awareness.
Amidst this dilemma, border riders stand a high risk of contracting and spreading HIV due to the nature of their job that hardly excludes temptations.
And if you are not faithful, you'll find yourself that you are already lured into acts which are not of importance for you. I always encourage people we should be going for checkups.
In contrast of people's perception about HIV in the 21st century, I sought for opinions of the youth in Arua City on whether HIV is still a major threat.
My fellow youths, they nowadays say that the HIV is just a malaria. They don't fear. Dressing code has contributed a lot.
People, when you get drunk, always when you go and sleep with someone you don't know about the status, you can easily contract the disease.
Donna Asere from National Community of Women Living with HIV, Nakuola, says rampant teenage pregnancies attest to the fact that young people do not fear contracting HIV, a case that was different in 1990s and the early 2000s.
During the early days of the HIV compared to now, the perception of young people are different. And actually, when Corona came in, many people forgot about HIV. That's why the number of people, young people, teens involved in sexual activities was high. Many people fear pregnancy more than HIV, forgetting that the same way you are getting pregnant is the same way you also get HIV infection.
According to a 2021 report by Uganda AIDS Commission, young and adults account for 40% of new infections. However, for many reasons, people have feared to disclose their status, and this continues to be a trap for many in contracting HIV through a person who does not disclose his or her HIV status.